I am Ngwashi Christabel, medical doctor practicing in Cameroon, and I'm also a health communicator. So I do a lot of health education online and on radio. So negatively, I think mentally, I am affected mentally first because every morning when I know I'm going to work, I know, okay, going to work today is a potential puts me at a potential risk of contracting COVID-19, first on my way to work and then in contact with patients. So it gives me that anxiety when I wake up, like, is today going to be that day? Is today going to be that day I'm going to come in contact with COVID-19? So I'm just anxious and I'm just like, and actually had to complain to my chief medical officer and we had to organize a mental health management course so that we as health workers should be able to manage the anxiety and all the mental stress that comes with this. And then coupled with the fact, again, one of my colleagues came in contact with a COVID-19 patient and had to be quarantined. So I've been in contact with this colleague and I'm just like, so what, so what, so what? So it just increases the anxiety that I have to go to work every day. Then secondly, it has also created a bias in my diagnosis, in the way I screen patients and in diagnosing patients. I don't know if it's just due to the anxiety or what, but before COVID-19, if somebody has cough, catarrh, fever, you can think of maybe pneumonia, is it a bronchitis, is it any other lung infection? But now you have a patient who just comes, I have cough, I have catarrh, you're just like, is this it? Is this it? Somehow your mind is just like, you just forget every other diagnosis with those symptoms and you're just like, this could be COVID-19. But all the same, you just say to yourself, it's better for me to think this is COVID-19 and the patient is quarantined than for me to think, no, it could be something else. And then later on, the patient is found to have COVID-19. So somehow it has created a bias in how I take the history and come up with a diagnosis for patients. Then on the brighter side, COVID-19 has helped me to actually prioritize and manage my time better. Because before now, maybe you miss a friend and it's surely the friend is accessible. You're just like, let me go check her up. You don't think like, let me call first or let me just go check. But now before you do something, before you go somewhere, I'm just like, is this place really important? Do I really need to be here? How important is this? So it has actually helped me to prioritize. And then during this period, you have a lot of free courses online, a lot of places. I'm sure the organization you work with also has a lot of courses given online. So I know that, okay, despite the fact that I'm working, I shouldn't make that an excuse not to take advantage of this time that the courses are free. So it has helped me to manage my time after work. I know I have to do this and also take advantage of this period that the courses are coming up. So yes, it's helped me to manage time better, to prioritize, and then to actually live healthier. Because as a busy professional, sometimes you forget what you preach. You preach like healthy living, everything, but sometimes it's difficult for you to actually live it. You come back from work, you're tired, you just want to pick something, put in your mouth, and then go to sleep. So it has actually helped me to know healthy living is important when I come back and I have to put up my internet and sleep so that I have enough rest for the next day. I know I have to actually create time, manage my time better to accommodate preparation of healthy meals and all of that. So yeah, that's the brighter side of it also. Because of COVID-19, you have negatives and then you have positives. So I'll just say it has created a change on both sides. One thing I've learned from this is with regards to the health systems. This has actually exposed a lot of loopholes in our health systems. And as someone who is very interested in global health policy, it's actually giving me an insight into what policymakers actually go through when they are faced with a situation like this. It's actually made me to understand that you don't prepare for war when you're already in war. You prepare for war before. And that's what you see in most, especially in Cameroon right now. We're trying to prepare for war when the enemy is already there and it's becoming really difficult. So one thing this has taught me is you don't prepare for war while in war. You prepare in advance, like this can happen, so we should prepare for it. Pandemics will always happen, so we should put in place an emergency plan, epidemic preparedness, and all of that.